Hi guys, it's Dr. Lily Johnston, board certified vascular surgeon here, and I want to talk about the first full day of the National Lipid Association conference because it was super exciting. So this morning we talked about the link between brain health and heart health, and I learned that up to 45% of dementia cases, which is predominantly Alzheimer's, but also includes things like Lewy body dementia and vascular dementia, up to 45% of dementia cases are either preventable or could be substantially delayed with appropriate risk reduction in midlife. We also talked a little bit about some of the new biomarkers, plasma-based biomarkers for cognitive decline in Alzheimer's, like p-tau and beta amyloid. And we also reviewed the role of the ApoE4 protein in the pathophysiology of Alzheimer's disease and cardiac disease. So the ApoE4 allele, you could have one copy or even two, is associated with late onset Alzheimer's disease, but it's also associated with significant risk for cardiovascular disease. The ApoE2 allele is associated with reduced risk for cardiac disease, except when you get something called beta lipoproteinemia. So that's kind of a fun thing we could talk about some other time. Later in the morning, we had a session specifically focused on women's cardiovascular disease and particularly early women's cardiovascular health. So this is preconception and pregnancy related cardiovascular health and the impacts of things like adverse pregnancy outcomes, including preeclampsia, gestational diabetes, gestational hypertension. All of these were covered, and they have a profound impact on women's cardiovascular health throughout their lifetime, starting as little as 10 years postpartum. So super underappreciated cohort of risk for many of our patients. We talked about the menopause transition and some of the really key things that happen during that time in terms of cardiovascular risk change and things like lipoprotein(a), which is predominantly genetically determined but can also increase after the menopause transition. And then this afternoon, we talked about cardiovascular imaging and early detection of atherosclerosis. And finally, we wrapped up with the link between obesity and cardiovascular risk and some of the newer modalities we have to treat that, like the GLP-1 receptor agonists, the dual GLP-1 GIP receptor agonists, and all that good stuff. So let me know what you want to hear more about. Please like and subscribe and tell me in the comments below where you want me to do a deeper dive. Take care. Talk more soon.